When it comes to the quality of care veterans receive, Robert Walton gives the VA in Harlingen an A. But the director for Texas Valley Coastal Bend Healthcare Systems admits they fall way below that mark when it comes to providing timely and accessible care to vets.
Ultimately, our goal is to try to get it done within 30 days. So, I mean, we have a ways to go to get to that.
He acknowledges staffing issues hinder wait times specific for optometry, ophthalmology, and audiology. Valley vets can be found on the official electronic VA wait list because they couldn't make a timely appointment. Robert says patients who don't get timely appointments over 90 days old are offered non-VA care to reduce waiting periods.
You know, I think it definitely means that we need to improve what we're doing in the VA. We need to make sure we have access to veterans. And we do want to make sure veterans come to us to get health care if they need it.
But for the veterans who do come for care, some aren't scheduled properly. Robert also acknowledges staff had to be retrained and a new checks and balance system put into place with an auditing agency to ensure that patients are being seen within the prescribed time frame.
So that if their provider wants to see them in 3 months, they're going to see them in 3 months. They're not going to see them when the next available appointment is.
Robert says he doesn't know of any Valley veterans who have died waiting for access to care despite other media reports. But what about a patient's condition worsening as a result?
And could that have led to more complications for the veteran?
Again, it could have, but again, we have a lot of veterans who walk in if they have urgent health issues, and I'm sure that they continue to do that.
The Harlingen VA healthcare system has been under a lot of scrutiny lately, including by Texas Senator John Cornyn. Former Associate Chief of Staff Dr. Richard Krugman claimed in a published report how cost-cutting led to denials and delays in life-saving cancer tests.
He indicated you have 3 positive fecal occult blood tests before we would do a colonoscopy. That's absolutely not true. I mean, we have one that becomes an urgent colonoscopy for any veteran who gets one.
Robert says the claims were disproved and the alleged whistleblower was fired for policy violations. While access to care remains a work in progress, he hopes veterans don't let the headlines turn them away from seeking care.